You're here for the ear appointment. Okay. Yeah, the ear pain. Okay. Well, you're at the right place. um, my name is Dr. V, and I'll be your ENT doctor for your visit. Have you been to an ENT appointment before? Oh, okay. Well, that's no problem. You're just gonna start with like the usual, getting a history and trying to figure out what's going on here before we dive into the test and such. So let me get my notebook. Okay. So, when did this earache start? Do you? Okay. Okay, and then on a scale of 0 to 10, 0 being no pain at all, and then 10 being the worst pain of your life, how would you rate your pain? Okay. I'm sorry. I had to deal with that for so long. I know it's kind of hard to get an appointment with a specialist. But don't worry, I'm going to treat you well today, okay? So I also want you to describe the pain. Is it like constant? Does it come and go? How would you describe it? Okay. Yeah, and that started, yeah. Okay. Okay. Let's go this side here. So, I also want to know, like, do you have any other symptoms beside that? I know you said your ear was hurting. You said you got ringing too, ringing on both ears, right? Okay. Any hearing loss or ear drainage coming out of those ears? Okay. Oh, so you do have a hearing loss? Is it both sides? Oh, okay. Interesting. Did you have any recent illnesses, or did you start any new activities? Did you travel anywhere? Maybe like swimming or to a water park? No? Have you had any surgery to your ear, nose, and throat? No. Okay, yeah, I thought so. You said you haven't been to an ENT. But you never know. Alright, that's all the questions I have for now. I'm just gonna go through a physical exam. So I'm just gonna look at the outside portion of your ears, okay? Move your hair out of the way. Okay. I don't see anything too concerning, okay? I'll go this side here. No. Okay. I'm gonna look into your ear. Just get a new thingy here. Okay. Okay. So I do see a little bit of drainage. Do have a good amount of earwax there. Are your ears normally waxy? Do you get this much? No? Okay. I'm gonna turn this off. Oh, I forgot to check up your nose for a second. Because those things are connected. So let's look up your nose. Let's see. You tilt your head back. Back, good. It does look a little bit inflamed in there too. Not too bad though. Do you get allergies? Just say, stick out your tongue. Okay. You just feel the sides of your jaw. Sometimes it can be like a TMJ issue. The pain is actually in your jaw, but you just don't really know, Okay. Does it feel tender? It does feel a little stiff. Um, but I think it's gonna be something else because of what I saw in your ear. Don't worry, nothing to be afraid of. Okay, so now I'm gonna use my tympanometry just to check the pressure, if there's any pressure in the middle ear, okay? Just gonna feel a little poke. And then I'm just gonna set my timer because I have to get it for a certain amount of time. For 2 minutes. Okay. Just gonna put this in here, okay? Hold it there. Just adjusting the pressure a bit. How's it feeling? Good. I change a little bit. Almost done with this side here. Okay. Let me just set the timer for the other side. I'm gonna do the same thing, okay? Okay, let's see here. How are you doing over there? Good. I do got a little bit pressure on the other ear, so let's see if it shows up on this side too. Okay, not bad. Okay, you're gonna do a little bit of a hearing test. So I'm gonna be snapping, and you're gonna hold up your hand to tell me how many times you heard the snap. Okay. Okay. So let's see. Yeah. Mm-hmm. Good. Mm-hmm. Three. And now you're gonna let me know when you hear the sound in your ear, okay? Yeah, it sounds really weird. Some of my patients really like the sounds of certain things. I get like tingles or something like that. Okay. Now we're gonna do the same thing, but with this little fidget slug, okay? Do you notice any hearing differences? You can hear a bit better in that, yeah. Yeah, I was expecting that. You had a little bit more earwax than the other ear. Okay, so I think I have a pretty good idea of what's going on with both your ears. So you do have an ear infection. So with that, we're gonna give you some antibiotic ear drops. Just because it's been going on for a while, so we're just gonna try to get rid of it. What also helps is putting a warm compress on your ears. Just hold it there. I'm just gonna do it right now, just to help some of the pain. These ones warm up from going like this to it. Okay, just gonna hold it there for 90 seconds. 1, 2, 3, 4, 5, 5. You do hold it there for about a minute and a half. So I did this side now. 18, 19, 20, 21, 'Cause your ears a little bit. Yeah. So I'm just gonna go ahead and put in your first dose right here. Okay. It's pretty thick. You just wanna like hold your head like this, and then pop it there. I'll just get some here. feel better. For now. Okay, so let me tell you your medicine, what you gotta do. So you want to make sure that you put 1 drop into each ear, particularly when you go to bed. These are the antibiotic drops. And then just to kind of help with like the irritation and some of the drainage, I'm gonna give you some Flonase. You just take this and then 2 sprays into each nostril. Also before bed, preferably. It's okay if you can do it in the morning, just be consistent. Okay. And then I'll also give you some ibuprofen. A nice big prescription. So this will help with the pain, which should subside about like several days after you start taking the antibiotic drops. So I want you to go ahead and give me a call if you get any worsening pain, you start to get more drainage, or you spike a fever for a while. Go ahead and call my office. We'll have to see you again. But in the meantime, I would prefer if you followed up with me in about a few weeks just to see how those ears are doing, okay? Yeah. Do you have any questions? No? Oh, you're welcome. I'm always glad to help. I've always had issues with ears, sinuses, all that stuff, so yeah. Well, I hope you have a good rest of your day, and I'll see you soon, okay?